I mean, it was a giant learning curve. I've owned 11 businesses up until now. So you get into a habit of thinking they're all going to be the same and it's all going to be easy. If every other business was like this to set up, so this one will be as well. And then I very quickly learned that allied health clinics have a bit of a mind of their own and are not like anything else at all.
Hello, everybody, and welcome to the Healthy Business Lab podcast, where we interview amazing allied health and related business owners to learn their nuggets of gold of what they've learned in business and from their expertise. And today I'm super excited to have Rebecca Challoner on the call today from National Peak Centre. Rebecca, welcome to the podcast.
Thank you. Thank you for having me.
So good to have you here. Again, we've had a pretty cool chat a little while ago. A serial entrepreneur that uses business to create social change and the like. So I'd love for you to share a bit about yourself and the background and, what you're doing in the space of allied health and the related spaces.
Yeah, well, I've been working in the sort of disability or neurodivergence sort of sector for just over a decade now, a bit longer, and doing a variety of things. But with the centres, with Peak Centre in particular, myself and the co-founder, Christina Keeble, we really wanted to create some multidisciplinary, collaborative allied health centres that were neuroaffirming. And back 5.5 years ago, neuroaffirming practice was not a thing. It didn't really exist, and we were so tired of taking our own kids to places where they saw these kids as a problem to be fixed rather than human beings to be celebrated. And we said, well, if other people aren't doing it, well, we'll do it, and then we'll create a way where it should be done like that. And then hopefully, with any luck, other centres will follow suit, because I'm a big believer, if you want to see change, you have to just model it, do it. And then when you do it, it becomes the way, because when people see that that's how it can be done, it forces the other places to sort of fall into line. And now, 5.5 years later, neuroaffirming practice is everywhere. And I think more and more clinics and different health-related businesses are starting to realise just how important it is, but also I think the community is starting to realise that it's do it that way or we're not going to pay you for services.
100%. And across that time period that you're talking about, I know that sort of replicates when we, as a family, became more aware of neurodivergence and with our own kids and the like. And so as you went into that, again, we love to share experiments that people have done in business and with their practices. And this idea of modeling and doing, no doubt you've had many iterations of what you did. I'd love to hear some of those early sort of learnings and iterations that you made that stick out in your mind.
I mean, it was a giant learning curve. I've owned 11 businesses up until now. So you get into a habit of thinking they're all going to be the same and it's all going to be easy. And, every other business was like this to set up, so this one will be as well. And then I very quickly learned that allied health clinics have a bit of a mind of their own and are not like anything else at all. So we had to do some very quick adapting to the industry, which took us a while to, first couple of years to figure out. The neuroaffirming practice side of things and embedding that was easy. We just did it how we wanted to see it done. The multidisciplinary thing, it was easy. We found that therapists loved collaborating, so getting that going was really, especially cross-discipline collaboration was really, really easy to get going. But there were many things we found hard. But I think the thing I found the hardest was expecting it to be like any other business in terms of running it as a business. And it isn't. It's a very different beast. It doesn't run like a coffee shop.
I'd love for you to unpack that a little bit further, because it's also a part of you don't know what you don't know. And you've no doubt learned that when you're talking about specifics in the allied health space. But I think a lot of allied health businesses start out in business and they'll hear a bunch of traditional business coaching or ideas and those sorts of things, and sort of because you don't know what you don't know and haven't been in business before, kind of go, oh, is that the norm? But notice there might be more friction points in that when they as they try to do things. So I'd love for you to unpack that, because I think that's some very useful information for our listeners in there.
Yeah, and to be honest, I enjoy running business, and I think being entrepreneurial and starting a business, it's hard work, but every business I've ever run, and these are a very wide variety of businesses within the disability field and outside of it, they all have similarities, except for allied health, where it's so different, and for a variety of reasons. When you're dealing with therapists, clinicians who have an expectation of how many appointments they're going to do, how many people they're going to see. But you're also dealing with the political side of things like the NDIS and stuff like that. And those two don't marry up. So often what clinicians and therapists expect to be the amount of people they might need to see, what the NDIS, for example, is prepared to pay for that is not going to make the business succeed, because those two things, they don't meet where they need to meet to make a business profitable. So you have to get very, very creative in ways to really think beyond the box to try and sort of create profits. But you also have to be really good at accounting. I have a law degree as well, and I use my law degree so much more than I expected I would, and I've ever needed to use it before as a business owner. I also feel like I needed to have an accounting degree. I don't have one. I feel I should have one. I know that much about accounting now. As a founder in any other business, I didn't need to have that much of a tight grip on finances, because the profit margins were much bigger. In this, the profit margins it's hard to make big profit margins. And on top of that, we're dealing here in Victoria with a therapist shortage. So it's hard to get the clinicians. And then we wanted neuroaffirming practice, so they need to be trained and they need to understand neuroaffirming practice. And then you're also dealing with things like recruiters, who I have a bit of a dispassion for, because they will try and squeeze as much money out of you as possible, and then they'll steal the staff back 6 months later. So all in all, we found marrying keeping the business afloat and the finances with keeping the culture and the therapists happy and keeping the culture there. When you've got a shortage in that particular discipline, is extremely difficult. So that's been a huge challenge.
Yeah, and I'd love for you to share what are some of the things that you've tried that even potentially you learn from, or then into the what has evolved to being again the nice working model that you've evolved to over time. I'd love to hear the story of how you've stepped through that and to get to where you are today, multiple sites. You're not able to do that when you're covering all the things that you just mentioned off, unless you've got a good model that then you can replicate and, work cross-disciplinary as well as cross-location. So, I'd love for you to share a bit of that. How have you gone about that, especially the culture into the practical? It needs to make money. Again, money can be a bit of a dirty word in allied health and health in general in many ways, but to be able to have the impact that you want to have, get the outcomes and those sorts of things. Obviously, our business need to be sustainable and profitable. But how have you managed to marry that with getting the culture right above all? Because I guess what I find in allied health, it's so much. It's about the people. They're very people focused and centric businesses from a practical staffing point, as well as what we're doing. So I'd love for your take on that evolution with your business.
Yeah, so figuring out the culture took us for a couple of years to really understand the culture of therapists. So we really now, to sort of keep the success within retaining staff and making people happy in their roles, we work really heavily on things like team time, collab time. We build in lots of PD. Therapists love PD. They love learning. Everything we give therapists PD budgets are built into their contract, but we also do tons and tons of in-house training. loads of it. They have so much PD, they have too much PD, if anything. We have PD channels that people are constantly uploading, and all the therapists are regularly sort of training each other interdisciplinarily as well. So everybody's learning from everybody else as well as learning from external and other people. PD, team time, that sort of thing is really well built in. The other thing we did that made the biggest difference in terms of being able to retain the mental health and strength of the therapists and keeping them happy whilst also bringing in some money was we changed the appointment structure. So we didn't change their KPIs. Their KPIs were always the same, but we changed the appointments from hourly to 90 minutes, with an hour of that being client facing and 30 minutes being for setup and pack down and helping a client transition if they're a slower transitioning client, notes, all that sort of stuff. Doing that, it spread the day out more for the therapists, which made the day a little bit easier for them. It also meant that we could, it was much easier then to meet their codes because they were doing more billable hours, but with less clients. So it really helped flow of the day. That's the biggest thing we did because it helped the profits and it helped the therapists feel happy and settled.
I just pictured the space was expanding, and it was that way of being able to create space around appointments, and then even that flow-on effect to clients. As you say, obviously, in this space, there are clients that sometimes need a bit more time coming in or going out, or both. Knowing our own kids, of how sometimes we have to manage that. It's creating that space and not feeling pressured around it. Again, you're coming back to, we love knowing our numbers here with the financial background of ours, but highlighting that you're able to do that. But you said there, it actually helped the KPIs. That's super cool.
Massively. And the other thing was, so our therapists had a KPI of 5 billable hours a day. But when we put them in 90 minutes, we'd give them 4 clients, which made 6 billable hours a day. So it meant that if people dropped off or there was cancellations, they were still able to easily meet their KPIs and have that sort of little allowance built in there, but without it taking a toll. If they did hourly appointments and we then tried to book 6 in, they'd have 6 clients a day. But we were able to keep it at 4 clients a day and they can still meet their KPIs. The other thing we did, which made a huge impact for the therapists and for us, was we created an over and above policy where every time they do go above their KPIs, they get a bonus per billable hour, and we obviously get a bonus as well. So it was bringing in additional money to us whilst also rewarding the therapist for going over and above their KPIs. So it meant that they were more likely to fill their time better because they're making more money from it. It also meant that because we were booking in 6 billable hours a day, it was really easy for them to attain that and get that. It still is really easy for them to get those bonuses, and it helps us because it's just additional money that we wouldn't have had if they had not pushed over and above. Those 2 things have been the biggest things to drive culture and profitability at the same time.
Yeah, nice. And what strikes me with that is that it's really an intentional design from both yourselves as the owners of the business and designing that out, but also for the clinicians. They can design there as to, again, managing their workload with their dollars and how they want to do that best at any given point in time. And obviously, by the sounds of that, there's flexibility for them to go, hey, these aren't overburdening KPIs, but then I say, yeah, I've got momentum, and with where clients are at, then yes, I can do a period where I have to go over and above and do that type of thing. So it just creates coming back to the cultural idea of that culture of intentional design. And again,
Absolutely.
Then that flowing on comes back to what you said before about the burnout aspect that is obviously rife in the field and in the space, that there's more people then and team members that are able to manage their mental health at the end of the day.
Yeah, definitely. And it wasn't when
Cool.
we first brought the over and above in, it was always sort of given to the therapists as it's their decision. They don't have to go over and
Yep.
above, but if they want to, they
Yep.
can. And so it's always been
Yep.
something that's in their hands. And if they do, that should be
Yeah.
celebrated. So what we do is sort of say, we appreciate any time that you are doing extra, and we don't want to force you to do that. So we'll let you decide. And if they don't do it, it's fine. They're still hitting their KPIs, life's, happy days. If they want to, there's the opportunities there for them. So we've been really big on trying to spread out their day and make it as simple and flexible and easy to go navigate as possible, and try and keep them really happy. We put in big blocks of admin time, blocks of team time, blocks of collab time all through the week. So they have loads of the collaboration time. I think is one of the things therapists really love, having that opportunity to have that multidisciplinary collaboration on their clients and anything they want to discuss or learn about. So we just find that all that sort of thing just helps really keep that culture going.
Yeah, and simplicity, the flexibility and collaboration found from, over the past 12 months of doing these podcast episodes, and, the types of guests that we seem to have on are those ones that are, the collaboration seems, front of mind, and, the thirst for knowledge. Everybody's a bit of a lifelong learner. And so, what you're sharing there is just echoing what I've been hearing definitely over the past bit of time. So I'd love for you to sort of, I'm curious about that multidisciplinary approach again, then for how that then flows on within your practices to the to the clients, so that if you've got a client that potentially needs the support of different modalities at different times of wherever they are and whatever their progress has been or whatever their challenges are, how do you approach that from a client-centric side of things?
Yeah. And actually, so when we first started it, as well as the neuroaffirming practice which is really what underpins us, the multidisciplinary side of things was the next most important thing, because we'd had so many experiences as parents of neurodivergent kids where you go to a psychologist over here and then you'd go to an OT over here, and the psychologist would tell you one thing and the OT would tell you the opposite thing. And you go, well, who do I listen to? And we just went, that should never happen. But if they're not just working in the same building, but literally working together and collaborating on your care, then that they're everything they're saying and the care that they're giving and the support and the strategies will all marry up. So that was really, really key, which is why for us, it's not just multidisciplinary, lots of disciplines working in the same space. That collaboration is key to making that work, which is why we build it into their time, so that they have to talk about it and they have to get together and discuss their client to make sure that it's really a team approach. So when a client comes in, they're not getting one therapist, they're getting a whole bunch of therapists all working together and getting the best from every angle. All our therapists are really heavily trained when they start on neuroaffirming practice. Myself and my co-founder, Christina, we're both experts in the field of neurodiversity ourselves. So we do tons of training with them. So when they come in, the standard they're sitting at individually straight away is really high in terms of their knowledge, regardless of whether they've been in the industry for 20 years or a new grad straight out of uni. We really thoroughly train them to get them going. So when they all come together and you've got all these team members with all these different knowledge bases of disciplines, then with all this extra training, the client who's receiving that collaboration is really getting an incredible support system and network around them. So we find it's really helpful.
Yeah, I love it. And again, what you've shared as a parent, the parent side of it as well, I think there's thousands upon thousands of parents out there that have that experience, and at some point they have of being able to bring that under the one roof, and you just know that everything is so aligned. That's the big word that I circled here, is a lovely alignment that happens for the for the clients. That's great. And so I think that dovetails nicely what we always like to talk about here as well, is the transformations we've seen. And again, some of this, I'm guessing, I'm picturing transformations not only for the clients that you've got, but also the team members that no doubt grow and evolve and the like. I'd love for you to share one or two sort of transformations that come front of mind in, obviously, you probably got countless of them over the 5 years that you touched upon there, but what's a couple that have sort of stick front of mind for you?
The biggest transformation, which is something that hasn't happened once, it's happened loads of times and we see it all the time, is when we bring in a therapist who doesn't know what neuroaffirming practice is, or they may have heard it as a buzzword, but they don't truly understand it, and then we teach them it. And you watch as their eyes widen, and over a period of however long we train them for, they realize how core it is to delivering that really truly person-centered supports to the client, and watching them go from someone who didn't know or care about neuroaffirming practice to someone who it becomes part of who they are and part of their core beliefs. We've seen that loads of times with therapists, and it's really fantastic. And the same thing happens with clients, often with parents when they've got kids they'll come to us with this approach of, please fix our child. They won't do this, they won't do that. We want to try and make them like neurotypical kids. And then we watch them as we work with the family and work with the parents. We also build in parent sessions. So we've got we're all working together with the parents as well, and help and watch the parents go from this sort of state of my kid needs to be like all the other kids to my kid is amazing exactly as they are, and we want to find them friends who are like them and make them feel perfect just as they are. It's just such an incredible thing to see.
Yeah, I love your phraseology of it as well. I go for some little goosebumps here. It's a beautiful way that you touched upon that. And I think highlighting the parent transformation, and that's probably why I've got there as well, because I know that throughout our learnings, when we've first become aware of neurodivergence through our kids, and then the self-evaluation of ourselves as parents as well, that process of just learning at that time, and again, 100%, I can just picture those light bulb moments that we seem to constantly have from being a part of the many of the sessions that we're a part of with our kids and their therapists. It's yeah, super cool. So I love that you've touched upon that as well. It's a lovely three-way transformation for the end, for the client, for the parents, and for the therapist. That's been brilliant. That is so cool. And I think I've got a couple of pages here already of my notes. And so I've got a feeling that we might need to get you back on for deeper dives in certain areas, but I'd love for you to share as well. I know you've just released a book, but by the time this comes out, the book will be a couple of months down the path as well. But I'd love for you to share where people can connect with you and get some of the many resources that you share, and you touch upon the amount of education you do in the neurodivergent space. Where's the best place for people to find you?
Yeah, so I have a website, which is just RebeccaChalloner.com. And on Facebook, I have a Facebook page as well. I do lots of, there's lots of resources on the website that people like, books and things like that. And I do I go into a lot of schools and workplaces and do training there. But I have just released a new book on rejection sensitive dysphoria, which for those of people who don't know is a extreme incapacity to process failure, criticism and judgment for people who are neurodivergent. It's very extreme, so we really can't cope with any kind of failure or criticism, even if it's perceived. It doesn't even have to be real. And it's such a misunderstood factor in a lot of neurodivergent people's lives. So I've just recently created that book, and that got released last Friday. So very, very new.
That's awesome. Well, I appreciate the shares. And as always, we'll put all those links and details into the show notes. But once again, really appreciate all the nuggets of gold that you've shared with the audience here today. Thank you very much, Rebecca. And as always, everybody, make sure you like, subscribe, whichever channel you're finding this on. Make sure you keep on hearing great stories and experiments and information. So thanks again, Rebecca. We really appreciate your shares today.
Thank you.
Thank you for listening to the Healthy Business Lab podcast. Make sure you subscribe to keep up to date with all the latest episodes.